A 8-month-old boy is being evaluated for poor weight gain since birth. He is noted to have bulky and greasy stools. A jejunal biopsy findings are shown below. Which of the following is the most likely diagnosis? Now, in the biopsy finding, we see enterocytes with foamy cytoplasm. This is going to be caused by accumulation of lipids within the intestinal epithelium, and this findings is going to be most consistent with abetalipoproteinemia. So the answer is going to be answer choice A. Now, the name of the disease kind of tells us what is going on. A means not having beta lipoproteins. The anemia part tells us that we're not having beta lipoproteins within the blood. Now, abetalipoproteinemia is going to be an autosomal recessive disorder that most commonly presents before the age of 1. So the patient in the question stem was a 8-month-old boy. Beta lipoproteins are really important in that it allows us to excrete out chylomicrons from the intestines and VLDL from the liver. Now, chylomicrons are going to be metabolized by our dietary lipids, and they need ApoB48 in order to be excreted out from the intestines. And so if we don't have ApoB48, then we're not going to be able to excrete out chylomicrons. As a result, we're going to be deficient. And so in the lab values that we see in these patients, we're going to have low levels of chylomicrons. VLDL is going to be endogenously produced in the liver by hepatocytes, and we need ApoB100 in order to excrete out VLDL from the liver. And so if we are deficient in this beta lipoprotein, then we're also going to see low levels of VLDL as a lab finding. Now, because VLDL is metabolized into IDL and LDL in the blood, and if you're not able to excrete out VLDL, then we're also going to be deficient in IDL and LDL. So we also see low blood values of IDL and LDL in these patients. Now, these are all going to be examples of lipoproteins. Lipoproteins are what allows us to transport lipids in the blood. And so if we are deficient in lipoproteins, then we're going to have trouble transporting and absorbing fats. So a common finding that we see in these patients is that we're going to be deficient in fat-soluble vitamins. Most commonly, vitamins A and E. A quick mnemonic that you can use to remember that these are going to be the two fat-soluble vitamins that are most commonly deficient is that the word beta has E and A in it. So this is how I remember that vitamin E and A are going to be the fat-soluble vitamins most commonly affected in patients with abetalipoproteinemia. Now, if we are deficient in vitamin E, then we're going to get spinocerebellar degeneration, which leads to ataxia. And if we are deficient in vitamin A, then this can contribute to retinitis pigmentosa. So ataxia and retinitis pigmentosa are going to be common findings in patients with abetalipoproteinemia. Now, on the histological slides, we're going to see acanthocytes, which are going to be the finding of these red blood cells having these spiny shapes to it. So as you can see in this picture, these red blood cells have these spiny shapes to it.